At 1:47 in the morning, a man with no name, no ID, and 3 bullet wounds hidden beneath a civilian jacket was wheeled through the doors of Hargrove General Hospital in Salt Lake City. The doctors told the nurse on duty to step back, to let the attending physician handle it, to stay in her lane. She stepped forward instead. 60 seconds later, she had her hands inside his chest cavity, keeping him alive with nothing but field pressure and instinct. 2 minutes after that, she was fired. What nobody in that hospital knew, not yet, was exactly who she had just saved. And if you're the kind of person who can't look away from a story like that, hit subscribe right now because I put out new stories every week and you do not want to miss what's coming next. Smash that like button, drop a comment telling me what city and country you're watching from. I want to see exactly how far this story has traveled. Now let's get into it. The call came in at 1:31 a.m. Male patient, approximate age 40, multiple lacerations, suspected internal trauma, unconscious on arrival. The paramedics who brought him in were tight-lipped in a way that wasn't normal. No chatty handoff, no eye contact with the triage desk, just a gurney moving fast and 2 men who disappeared back through the ambulance bay doors before anyone thought to ask them for a report. One of them dropped the intake clipboard on the counter without breaking stride. The other didn't even do that much. Mara Solins was the charge nurse on the overnight shift at Hargrove General, and she had seen enough strange arrivals in 6 years to know when something felt wrong. This felt wrong from the first second. The patient had no wallet, no phone, no medical bracelet, no emergency contact written on anything. His clothing was civilian, dark jeans, a gray Henley, a canvas jacket that had been partially cut open by the paramedics during transport. But the jacket was wrong. The fabric was too thick, too structured along the shoulders, the kind of weight that didn't come from a department store. The stitching on the inner lining was tight and deliberate, the kind of work you only saw on gear that was expected to take stress. She flagged it to the attending on call, Dr. Warren Tillis, who barely glanced at the jacket before ordering it bagged and tagged with the rest of the patient's effects. Probable assault victim, Tillis said, already pulling on gloves and moving toward the bay. Get me a blood panel and imaging, and keep the area clear. I don't want half the floor crowded around my patient. Mara wrote it down and relayed the order to the desk. She moved on to the next item, the way you had to at 1:30 in the morning, when the board already had 7 active cases and 2 more in triage waiting. You kept moving. That was how the overnight worked. That was when she noticed the new nurse standing at the edge of Bay 4, not moving. Her name was Nora Voss. She had been on staff for 11 weeks. Still technically on probationary review, still the nurse. The senior staff handed the difficult patients to because she was too new to push back effectively. She was small, the kind of small that made people underestimate her without meaning to. With light brown hair she kept pulled back in a low knot and gray-green eyes that were quiet and took in more than they gave back. She was 29, but she looked younger than that, which compounded the problem, because people decided things about her before she'd had the chance to demonstrate anything. Right now, she was standing completely still at the edge of the restricted bay, her gaze moving across the patient in a way that didn't look casual. Voss, Mara said, Bay 4 is closed. Dr. Tillis wants it clear. Nora didn't move immediately. Her eyes tracked methodically. The patient's face, his neck, his left arm, the angle of his shoulder against the gurney mattress. Something in the way his body was positioned that Mara couldn't identify from across the room. His collar, Nora said quietly. What? The collar on the jacket. Before they cut it, did anyone look at it closely? The structure of it? Mara glanced at the bagged jacket sitting on the supply cart near the bay entrance. Everything's been secured and logged. Whatever's relevant gets reviewed in the morning. It should be reviewed now. Nora's voice was even, not pushy, not dramatic, just flat and certain in a way that felt oddly practiced, like someone reading coordinates instead of making a suggestion. And someone should check his left shoulder, below the collarbone, running toward the scapula. The bruising pattern there isn't consistent with an assault or a vehicle accident. The distribution is wrong. Tillis heard that from inside the bay. He came to the doorway with a chart already open in his hand and looked at Nora the way that attending physicians looked at probationary nurses who had decided at nearly 2 a.m. to have clinical opinions about a patient they hadn't been assigned. You're Voss? Yes. How long have you been a nurse? She held his gaze without blinking. Long enough to recognize blast pattern bruising. It was precisely the wrong answer. Not because it was inaccurate, she would be proven right before the night was over, but because there was a specific social architecture in a hospital at 2 a.m. And probationary nurses who used phrases like blast pattern bruising in the doorway of a restricted bay were violating it in ways that tended to have consequences. Tillis wasn't cruel, but he was the kind of physician who had spent 2 decades being the most qualified and most experienced person in any room he entered, and he had long ago lost the reflex of taking challenges seriously before they'd proven themselves. He pointed at the corridor. "I've got this. Go check on bed 7. Nora held his gaze for one more second. Then she left without argument, which was the other thing about her that people read wrong. They assumed that because she didn't argue, she had accepted the outcome. She hadn't. She was just choosing where to spend the energy. Bed 7 was a 16-year-old named Tyler who had fallen off a skateboard at midnight, sprained his left wrist badly, and whose mother was in the waiting room absolutely convinced that he had fractured both arms and possibly his collarbone. Nora took his vitals, updated the chart, walked the mother through the clinical distinction between a sprain and a fracture for the second time in 20 minutes, answered 3 questions she had already answered, and kept the surface of her attention entirely on bed 7, while the deeper layer of it stayed fixed on the hallway. She had always done this, operated on 2 tracks simultaneously, one performing the visible task and one monitoring the environment. It wasn't something she'd chosen as a nursing strategy. It was something built into her at a level that preceded her nursing degree by several years, something that had been drilled in until it stopped feeling like a discipline and started feeling like instinct. You watched exits. You counted personnel. You listened to the quality of silence after an alarm stopped, whether it was the silence of a resolved problem or the silence of a problem getting worse. Bay 4 had been quiet for 4 minutes when the alarm went off. She heard it from the hallway, oxygen saturation dropping. The monitor's tone was the kind that changed pitch as the number fell, and she was already counting backward from the number she'd last seen on his chart, 95 when he came in, which was low but manageable. The alarm tone said it had dropped further, fast. She heard Tillis's voice, sharp and controlled. "Get me the mask. Where's his airway? Why isn't the—" She was already moving. She pushed through the bay door and read the room in under 2 seconds. The patient's head had shifted against the pillow, his jaw slack, and the oxygen mask was sitting at the wrong angle because no one had accounted for the specific way his neck was compensating. Tillis was reaching for the intubation tray with focused efficiency, which was the right solution to the wrong problem. The monitor read 84 and dropping. "His airway is obstructed," Nora said. "It's positional, not a full blockage." "I can see what it is. His cervical spine has old trauma. 3rd vertebra, maybe C3, C4. The way his head is angled is compressing it. You need to tilt right, about 15 degrees, but you can't force it. There's resistance in the scar tissue, and if you push through it, you'll make the obstruction worse." Tillis had the intubation kit open. His hands were ready. "If you intubate through that compression," Nora said, not raising her voice, "you'll cause secondary trauma to a spine that's already compromised." The monitor hit 81. Tillis looked at her. For 1 second, one long, specific second, the authority dynamic in the room was suspended while he made a clinical calculation rather than a social one. He stepped back. Nora moved to the head of the gurney. She placed both hands on the patient's jaw and skull with a precise, practiced grip that was not what they taught in standard nursing programs. It was something else, something that knew how to navigate damaged structure without textbook terminology to describe it. She felt the resistance at the 3rd vertebra exactly where she'd expected it, worked around it with a controlled lateral pressure, and eased the head 15 degrees right. The airway opened. The monitor climbed. 84, 87, 91, 94. The alarm stopped. The room was very quiet. Tillis lowered the intubation kit. His hands were still. He looked at the patient, whose color was already improving, whose chest was now rising with the smooth rhythm of someone who was breathing the way they were supposed to. Then he looked at Nora. The expression on his face had moved past irritation into something colder and harder to name. He wasn't angry at the patient. He wasn't angry at the situation. The anger, if that was what it was the specific, contained anger of a person who had just been outperformed in front of his own equipment. "You were told to stay out of this bay," he said. Nora was checking the IV line, making sure the angle of the patient's arm hadn't shifted during the adjustment. He needed help. You are an 11-week probationary nurse who overrode the clinical judgment of an attending physician in a restricted treatment area. I didn't override a judgment. You hadn't made a decision yet. There was a 90-second window, and I used it. She looked up. Her voice was completely steady. He's breathing. Tillis walked out. He went directly to the administrative desk where Paul Deering was covering the night. Deering was 53 years old, heavy-set, with the particular political intelligence of a man who had spent a career navigating the space between hospital ideals and hospital realities. He listened to Tillis for exactly 45 seconds, asked 2 clarifying questions, and stood up. Nora was still in Bay 4 doing a secondary check on the patient's oxygen line when Deering appeared in the doorway. Nora Voss, she looked up. Come with me, please. She recognized the tone. She'd heard variations of it in other rooms from other people, in circumstances that were significantly higher stakes than this one, and the recognition was automatic and unpleasant. She looked at the patient one more time, steady breathing, oxygen sitting at 96, color back in his face, and followed Deering into the corridor. The conversation in his office lasted 9 minutes. He was not unkind about it. He laid out the sequence of events clearly. She had entered a restricted bay against direct instruction from an attending physician, had made an unsanctioned clinical intervention on a patient who was not under her care, and had done so while on a probationary contract that explicitly flagged conduct violations as grounds for immediate termination. He was sorry, he said. He'd reviewed her patient feedback scores and her charting quality was excellent. But the policy existed for reasons, and the reasons applied tonight regardless of the outcome. Her badge and her access keycard went on the desk between them. Nora sat across from him and listened to all of it. She didn't argue, not because she thought he was right, but because she understood the terrain. This office, this conversation, this 9-minute window. None of it was where the real argument would be made. She knew the difference between a battle you fought now and a battle you waited for, and she had learned that distinction in conditions that made tonight look like a scheduling disagreement. Your final pay period will be processed through payroll, Deering said. You'll receive the formal separation letter within the week. I understand, she said. She looked at her badge on the desk. The photo on it was from her first day. Hair slightly shorter, expression carefully neutral, the specific flatness of someone performing relaxation for a camera. She left it on his desk and walked out. The walk from Deering's office to the ER exit was 214 steps. She counted them without deciding to. She passed the nursing station where 2 of the overnight staff looked away when she came through, and one, a younger woman who'd only been on the floor a few weeks, watched her with an expression of open, unguarded distress. Nora almost said something, decided against it. She pushed through the ambulance bay doors into the cold. Salt Lake City at 2:00 a.m. had a specific quality to it. Not silent exactly, but compressed, like the city had pulled all its noise inward for the night and left only the cold and the distant mountain dark in its place. The parking lot was lit by overhead floods that gave everything a flat, colorless look. Her breath made a small cloud in front of her face. She stood outside and let herself feel it for a moment. Not the anger. She'd already established that it wasn't quite anger. More like a pressure behind the sternum, the specific frustration of someone who had done the right thing with precision and speed and had been punished for it in the same motion. It sat there, dense and unremarkable, and she didn't try to move it along faster than it wanted to go. She had left her coat inside. She realized that now, standing in the February cold without it, and the fact that she'd forgotten it, that she'd walked out without running through her standard mental checklist, told her the frustration was sitting deeper than she'd admitted to herself. She started walking toward the staff lot. She made it 40 feet. The sound came from the north. She heard it before she consciously processed it. A low frequency, deepening as it grew, the specific percussion of military rotors that you felt in your back teeth before your ears had fully registered what it was. She stopped walking. Her body stopped first. Her mind caught up a half-second later. 2 Blackhawks came in over the northern ridgeline, fast and low, running dark, and they weren't heading for the hospital's rooftop helipad. They were descending toward the main lot, toward the large paved area near the front entrance that was technically reserved for ambulance staging and that a military pilot would look at and decide was acceptable without asking anyone's permission. Nora stood in the staff lot and watched them come down. The first one touched the pavement with controlled precision. Skids barely settled before the side door came open. 8 figures emerged before the rotors had fully wound down. They spread out across the lot in a pattern that wasn't aggressive, no drawn weapons, nothing theatrical. But the shape of their movement was unmistakable. They were oriented. They were assessing. Every one of them knew exactly where the building entrances were before they'd taken 10 steps, and they'd already identified the sight lines. The second Blackhawk set down 60 seconds behind the first. A single figure stepped out of that one. Tall, late 30s, unmarked tactical clothing, no visible insignia anywhere. He moved with the specific, unhurried certainty of a person who had already made all the decisions that mattered and was now simply executing them. They went through the front entrance without pausing at the doors. Nora stood in the cold for 3 seconds. Then she turned around and walked back. She heard the conversation before she reached the lobby. The man from the second helicopter was at the main desk, and Dale, the overnight charge nurse who had worked Hargrove General for 11 years, and who Nora had never once seen look rattled, was answering him with the careful, measured responses of someone who understood that the normal calculus of patient information privacy had been superseded by something he didn't entirely have a framework for yet. "Bay 4, Dale said. "Attending is Dr. Tillis." The man was already moving before Dale finished the sentence. In his wake, 2 of his team peeled off to cover the lobby entrance. 2 more moved toward the ER corridor. The remaining 4 spread through the space with the practiced ease of people who had cleared buildings before and were currently doing something much less urgent, which meant they were doing it with about 30% of their actual capacity. It was, Nora thought, like watching a professional athlete jog. The man's name, she would learn shortly, was Commander Seth Braxton. He was 37 years old. He ran a classified interagency coordination unit that operated out of a joint base she would not be told the name of. He had been in the air for 41 minutes when his team located the patient, and in those 41 minutes he had been operating with incomplete information in a way that he found genuinely intolerable and was very good at not showing. He found Tillis in the corridor outside Bay 4. Nora came around the corner from the ambulance entrance just as the conversation started, and she stopped at the edge of the hallway and didn't announce herself, because the scene in front of her had a momentum that she didn't want to interrupt, and because she had learned, a long time ago, that staying quiet was how you learned things. Tillis had the posture of a man who was preparing to explain hospital protocol to someone he'd assumed would need it explained. He was already wrong about that. "This is a restricted patient care area," Tillis began. "I'm going to need to see some form of—" "How is he?" Braxton said. Not a question, a statement with a rising inflection at the end that was purely conversational, the way you'd ask about a friend. Tillis recalibrated. "The patient is stable. He had a brief respiratory event approximately 20 minutes ago, but it's been resolved." "How was it resolved?" A pause. Something moved across Tillis's face, a shadow, a recognition he was just beginning to reach. A member of the nursing staff made an adjustment to his positioning. "Which nurse?" She's no longer on duty." Braxton went very still. Still in the specific way that very controlled people went still when they were giving the other person exactly one chance to explain themselves before they stopped being patient about it. "What does no longer on duty mean?" Tillis's jaw tightened slightly. "There was a conduct issue. She entered a restricted bay against direct instruction and interfered with—" "She saved him?" The word dropped into the hallway with a clarity that made the nearest 2 members of Braxton's team both look up. "The patient's outcome was positive, yes, but the procedural—" "She saved him and you fired her." Tillis said nothing. Braxton turned to this woman on his immediate left, a compact dark-haired member of his team named Riva. "Find her, she hasn't had time to clear the lot." He turned back to Tillis. "And I need whoever made the termination decision standing in front of me in the next 10 minutes. He walked past Tillis into Bay 4 without waiting for a response. Riva found Nora at the ambulance bay entrance. She heard the footsteps approach, one set, even pace, not urgent, and turned before the woman spoke. Riva stopped at a respectful distance. She noted the distance, Nora thought, deliberately. "Nora Voss?" "Yes." "Commander Braxton wants to speak with you." "I've been terminated. I don't have active staff clearance to be in the building." "I know." Riva's voice was professional, neutral, without performance. He still needs to speak with you. Nora looked at her for a moment. Then she looked past her toward the lobby, where she could see the shape of people moving through the lit space with that particular economy of motion. The patient, Nora said. Who is he? That's what the commander wants to discuss with you. Nora held her gaze for another second. Something in the back of her mind was already running the sequence. The jacket, the bruising, the subcutaneous scar, the way the paramedics had disappeared, the Blackhawks arriving 40 minutes after the patient. And the sequence was adding up to something she didn't want to add up to, because the last time she'd been in the middle of something that added up this way, it had taken 3 years out of her life. She turned and went back inside. Braxton was standing in the corridor outside Bay 4 when she came around the corner. He watched her walk toward him with an attention that was entirely clinical, not sizing her up exactly, more like an experienced person confirming a hypothesis they'd already formed. She stopped 3 feet away, didn't offer her hand, didn't fill the silence with anything. He was the one who spoke first. You're the nurse who cleared his airway. I'm the nurse who got fired for clearing his airway. A brief pause. Something shifted at the corner of his mouth that wasn't quite a reaction. Tell me what you saw when he first came in. She looked at him, made a decision. His jacket was built wrong for a civilian garment. The collar structure was load-bearing in a specific way, the kind of thing you see in gear designed to support communications equipment or a plate carrier system. And the bruising on his left shoulder wasn't impact trauma. The distribution pattern was diffuse in the wrong direction. It ran inward toward the sternum, which is consistent with blast overpressure against body armor at relatively close range. She paused. There was also a scar behind his left ear consistent with a subcutaneous communications implant. Recent removal, within the last 2 weeks, based on the healing. Braxton was completely still. The airway issue was a positional obstruction at the C3-C4 junction, Nora continued. He has old scar tissue there from a prior injury. The way he was positioned on the gurney was compressing it. The attending was going to intubate, which would have forced the obstruction and caused secondary spinal trauma. I adjusted his head angle, and the airway cleared. How did you identify the cervical trauma without imaging? The way his head moved when he was unconscious. There's a specific compensatory pattern when C3 has significant scar tissue. The muscles around it contract slightly even in an unresponsive patient, and the head resists lateral movement in a particular way. It's recognizable if you know what you're looking for. Braxton held her gaze for a long, quiet moment. Where did you serve? He asked. The question was even, not accusatory, not a trap, just a door being held open. Nora looked at him without expression. I'm a civilian nurse. You were, he said. Before that. She said nothing. He let it go. For now. The patient's name is Colonel Marcus Hale. He coordinates classified special operations across the Northwest Command. He was brought in tonight with injuries that don't correspond to any incident report, any accident log, or any event that should have occurred. Braxton's voice was level, factual, the voice of someone who had decided that the fastest way to get what he needed was to give her what she needed first. He's alive because of what you did in the last hour. Nora processed that, kept her face still. He wasn't just injured, Braxton said. Someone put him here, deliberately, in a civilian hospital with his identification removed and his communications device extracted, where the people treating him wouldn't know who he was or what they were dealing with. He paused. Someone wanted him to die in a place where his death could be explained. The hallway was very quiet. Through the bay door, the monitors kept their soft, steady rhythm. A man breathing who might not be breathing if she'd listened to the order to stay out. What do you need from me? Nora asked. Everything you observed, every detail you noticed when he came in, before the jacket was bagged, before anything was moved or documented. He paused. And I need you here when he wakes up. I've been terminated. I'm not authorized. I'll handle the authorization. She looked at him for a moment. Down the corridor, one of his team appeared in a doorway and gave a small 2-finger signal. Braxton's focus sharpened. He's waking up, Braxton said. He looked at her. Come with me. Nora stood in the corridor for 1 second. No badge, no coat, no standing in this building except whatever this man was about to arrange. She thought about the 3 years she had spent being a different person, the deliberate construction of a quieter life, The specific discipline of staying inside the lines she'd drawn for herself, doing her job, helping people with her hands instead of with everything else she knew how to do. She thought about all of that. Then she walked through the bay door. Because Colonel Marcus Hale was stable, but stable wasn't safe, and whoever had put him in this hospital tonight had done it with enough operational precision to strip his identity, extract his communications implant, and route him into a civilian ER where no one would know what they were looking at. Except one person had known. One person had stood at the edge of Bay 4 and read the evidence before anyone else in the building had seen it, and now that same person was standing in the doorway of a classified military officer's treatment bay at 2:03 a.m., still wearing her scrubs, with her terminated badge on an administrator's desk down the hall, and 3 years of very careful distance unraveling behind her in a trail she could already see she was never going to be able to follow back. The monitors beeped their steady rhythm. On the gurney, Colonel Marcus Hale's eyes began to open, and the first thing he said, in a voice that was rough and barely there but absolutely deliberate, was a single word. Not a name, not a location, not a request. A call sign. Spoken directly toward the corner of the room where Nora Voss was standing. The word hung in the air of Bay 4 like something that had weight. Not his name, not a request for water or painkillers, or the standard disoriented questions that patients asked when they came back from the edge of unconsciousness. A call sign. 2 syllables, rough and deliberate, aimed at the corner of the room where Nora Voss was standing, as if he'd known she was there before he'd fully opened his eyes. She didn't move. Braxton was at the side of the gurney in 2 steps, his hand on Hale's shoulder. Not restraining, just grounding, the practiced touch of someone who had done this before, brought men back from bad places, and knew the first few seconds were the ones that mattered most. "Marcus," Braxton said quietly, "you're at a civilian hospital in Salt Lake City. You're secure. Don't move yet." Hale's eyes were open but not focused. They moved across the ceiling, then the equipment, then Braxton's face, with the specific inefficiency of someone whose brain was still sorting signal from noise. His lips moved again. "Lark," he said, clearer this time. Nora felt the name land somewhere in her chest like a stone dropped into still water. She kept her face exactly where it was. Braxton turned to look at her, and whatever he saw in her expression, or didn't see, made him turn back to the colonel without comment. "He needs to stay still," Nora said. "His pressure's been unstable. If he tries to sit up—" "I know," Braxton said. He wasn't dismissing her. He was agreeing with her. The distinction mattered, and she noticed it. Hale's hand moved on the gurney mattress, a slow, searching motion that found the side rail and closed around it. He was trying to anchor himself to something physical while the rest of his system came back online. His color was still poor, the IV was doing its work but slowly, and the monitor above his head was showing a heart rate that was elevated in the way of someone whose body was reacting to things his conscious mind hadn't finished processing yet. "Where?" he started. "Salt Lake. Hargrove General." Braxton leaned slightly closer. "You were brought in by civilian ambulance. No ID on you. Do you remember what happened?" A long pause. Hale's jaw worked. "Partial. Partial is fine. Don't push it." His eyes moved again. They crossed the room with more focus this time, and they found Nora in the corner where she was standing, and they stayed there. He looked at her for a long moment with an expression she couldn't read. Not recognition exactly, not gratitude, something more complicated than either of those, something that had history in it. "You're not staff," he said. His voice was rough and thin, but the observation was precise. "Not anymore," Nora said. He processed that. Something shifted in his face. "You did the airway." "Yes." Another pause. He looked at her the way a person looked at a problem they were trying to solve when they were only operating at about 60%. "How did you know about C3? "I've seen it before." He held her gaze for 3 more seconds. Then he looked at Braxton. "She needs to be in the room." "She is in the room," Braxton said. "I mean, officially." "Working on it." Hale closed his eyes. Not unconscious. She could see the flicker of movement beneath his lids, the tension in his jaw that meant he was actively thinking, cataloging, trying to build a complete picture from incomplete pieces. It was the expression of someone who was in pain and managing it through focus rather than through any available medication, which told her something about him that she filed away without comment. Outside the bay, she could hear the hospital adjusting around the military presence, the particular hush that settled over a floor, when people understood that the normal rules of the evening had changed and were waiting to find out what the new rules were. Footsteps were quieter. Voices had dropped. Even the overhead PA, which normally crackled with the flat bureaucratic rhythms of a hospital at night, had gone still. Riva appeared in the bay doorway. She looked at Braxton and gave a small nod toward the corridor. Braxton looked at Nora. "Stay with him." She almost said that she wasn't his nurse. She wasn't anybody's nurse tonight. Her badge was on Deering's desk, and her access was terminated, and she was standing in a restricted treatment bay on the word of a military commander she'd met 11 minutes ago. She stayed. Paul Deering arrived at Bay 4 at 2:26 a.m., looking like a man who had been moving through a situation that kept revealing new dimensions he hadn't anticipated. He had his administrative tablet under one arm and the expression of someone who was trying to project authority in a room that had stopped recognizing his particular kind of authority about 40 minutes ago. Braxton met him in the corridor. Nora watched through the bay window, the glass partition that ran along the upper half of the wall, standard in trauma bays, meant for quick visual checks from the hallway. She watched Braxton talk and Deering listen, and the specific progression of Deering's expression from defensive to uncertain to something that looked like the early stages of genuine alarm. She watched Deering's eyes move to the bay, find her standing next to Hale's gurney, and stay there for a moment. She looked back at him without looking away. He looked away first. The conversation in the corridor lasted 6 minutes. When it ended, Braxton came back into the bay and said, without preamble, "Your access has been reinstated for the duration of this situation. Deering is contacting the hospital director." "It's 2:30 in the morning," Nora said. "I know." "What did you tell him?" Braxton glanced at Hale, who appeared to be resting but almost certainly wasn't. "Enough." That was when Tillis appeared behind Deering in the corridor, and Nora watched the attending physician look through the glass at her standing at the head of Hale's gurney and the monitors and the IV lines she'd adjusted and the colonel who was alive and breathing with good oxygen saturation, and she watched Tillis's face do something complicated that wasn't quite remorse and wasn't quite anger and wasn't quite the simple vindication she might have expected to feel from watching it. She felt nothing particularly clean about any of it. Clean feelings were for situations with clean edges, and this one had no edges she could find. Hale opened his eyes again. "There's a drive," he said. His voice was stronger than it had been 15 minutes ago. Not strong, but moving in the right direction. Left inside pocket of the jacket, small, looks like a medical ID chip. Nora looked at Braxton. "The jacket was bagged and logged," she said. "It's at the nursing station." Braxton was already out the door. Hale's hand moved on the rail again. "If they went through the jacket, I'll tell him," Nora said. She leaned slightly toward the bay door and said, at a volume that carried without being loud, "Braxton, the bag may have been accessed during intake. Check the seal." A pause from the corridor. Then, "Riva, with me." Hale exhaled. It was a careful sound, deliberate. The exhale of someone managing a significant amount of pain with a significant amount of practice. Nora checked his monitor. Blood pressure coming up slowly, heart rate still elevated, but the trend was better, and adjusted the IV flow rate by a fraction, the kind of small correction that took more than 11 weeks of nursing training to know was necessary. "How long have you been here?" Hale asked. "At this hospital." 11 weeks. A pause. "Before that?" She adjusted the tape on his IV line. "I was somewhere else." He looked at her profile. She could feel it. "Lark," he said again, quieter this time. Not an address. Almost a confirmation. She turned and looked at him directly. "You should rest." "I've been unconscious for—" "That's not the same as rest, and you know it." His mouth moved. Not quite a smile. More like the ghost of one. The thing a smile looked like on a face that hadn't done it in a while. "Fair," he said. He closed his eyes again. "Bob." The jacket seal had been broken. Braxton came back into the bay 8 minutes later with the bag jacket in his hand and an expression that had gone flat in the specific way of someone who had just confirmed something they'd hoped they were wrong about. He set the bag on the supply cart and looked at it for a moment before he looked at anything else. "The inner lining was accessed," he said. "The drive is still there, but the position is wrong. Somebody moved it and put it back." The bay was quiet. "How many people handled the jacket before it was bagged?" Braxton asked. Nora thought back through the sequence. The paramedics cut it during transport, 2 of them. Tillis ordered it bagged when the patient came in. He called it himself. One of the intake nurses logged it. She paused. And the paramedics were gone before anyone thought to get their names. Braxton looked at her. "You noticed that?" "It was unusual." "Did you get a look at them?" "One of them, briefly. Male, mid-30s, right-handed, about 6'1". He was wearing standard paramedic gear, but his boots were wrong. They were tactical, not service boots. The sole pattern was military surplus. Braxton held her gaze for a moment. Then he turned to Riva in the doorway. "I need the ambulance dispatch records for this hospital going back 4 hours. And I need someone to pull the parking lot footage from the ambulance bay entrance. We don't have jurisdiction over hospital. Get Deering to pull it." Riva left. Hale, who had appeared to be resting, said without opening his eyes, "There were 2 of them in the vehicle. The driver never came in. He stayed with the rig." Braxton looked at him. "You were conscious during transport?" "In and out." A pause. "Enough." "Do you know them?" "No. But the one who came in, the way he moved when he handed me off. He didn't want to be seen. I was angling away from the entry cameras the whole time." His voice was thin but precise. "That's not an accident. The monitors kept their rhythm. Outside the bay window, the corridor had the particular quality of a space where people were moving with careful purpose. Braxton's team redistributed across the floor, a quiet geometric rearrangement that Nora had been tracking peripherally for the last 20 minutes. 2 at the main entrance, 1 at the elevator bank, 1 near the stairwell at the north end of the corridor. They had closed a perimeter without announcing one, and nobody on the floor had said anything about it because the presence of 8 people in tactical gear coming off military helicopters at 2:00 a.m. tended to settle the question of who was setting the terms. Nora stood at the foot of Hale's gurney and worked through what she knew in the systematic way she'd been trained, not by nursing school, but before that, in a different kind of institution, with different kinds of teachers who had very little patience for incomplete assessments. A classified military officer, stripped of ID and communications, delivered to a civilian hospital by paramedics who weren't paramedics, with a drive in his jacket that someone had accessed before the bag was sealed. Brought in alive, but in bad enough condition that without intervention he would have died, quietly, in a restricted bay, as an unidentified assault victim. The goal hadn't been to put him somewhere safe. The goal had been to put him somewhere he would die in a way that was explainable. She looked at Braxton. "The injury pattern," she said. "When I first assessed him, the blast bruising on his left shoulder. The force distribution was specific, directed. Not a random overpressure event." "What does that mean?" "It means whatever went off near him was positioned deliberately, shaped, maybe. Something designed to incapacitate without killing outright." She paused. "Whoever did this wanted him alive long enough to be transported. They needed him to arrive at a hospital so his death would be logged as trauma mortality, not a targeted action." Braxton absorbed this. "They wanted a death certificate from a civilian facility, with no military footprint on it." Hale had opened his eyes again during this exchange. He was listening with the specific quality of attention that came from someone who was doing the very difficult work of hearing information about his own near death and processing it as tactical data instead of personal crisis. "The operation," he said. His voice was careful. "The one that was running out of Meridian Station. It's been compromised." Braxton went very still. "Marcus, you need to know." "Not here. There may not be a better time." Hale's eyes moved to Nora, then back to Braxton. "She can hear it. Hear it. She's a civilian nurse who—" "She's not," Hale said, flat, certain, no qualification. The bay was completely quiet. Braxton looked at Nora. The look was long and careful and had the quality of someone revising a calculation they'd been running since they arrived. "Who are you?" he said. "Not hostile, just direct." Nora looked at the monitors. She looked at Hale's IV line. She did the small, necessary things that needed doing and didn't answer immediately, not because she was stalling, but because there was a version of this conversation she wanted to have and a version she didn't, and she was deciding which one this was. "My name is Nora Voss," she said finally. "I'm a nurse. I've been one for 3 years." "And before 3 years ago?" She looked at Braxton steadily. "Before 3 years ago, I was doing work that I can't describe in a civilian hospital at 2:30 in the morning." It wasn't a confirmation. It wasn't a denial. It was the kind of answer that people trained in certain environments gave when they were trying to be honest without being operational. And Braxton recognized the shape of it immediately because he gave those answers himself. He didn't push. He turned back to Hale. "What do you need?" "The drive secured, properly this time." Hale shifted slightly and didn't hide the wince fully. It got through his control, a small tightening around the eyes. "And I need to know who pulled our location before tonight. Someone knew where I'd be. That's internal." "I know." "Which means your team—" "I know, Marcus." Braxton's voice was quiet. "I've already started the audit." Hale looked at him for a moment. The look between them was the look of two people who had worked in close proximity under difficult conditions for long enough that they had moved past the need to perform trust for each other. They either had it or they didn't, and both of them knew which it was. "How many people knew the transport route tonight?" "7, including me." "Then it's one of 6. Or someone with access to one of 6. Hale closed his eyes again. This time he looked more tired than strategic, and Nora recognized the particular exhaustion of someone whose body was demanding payment for the last several hours, whether they were finished with the situation or not. "I need an hour," he said. "Then I need a secure line." "You need 4 hours," Nora said. "Minimum. Your pressure's been unstable and you've been conscious for less than 30 minutes. If you try to operate on 1 hour of recovery, you're going to make errors." A pause. Hale didn't open his eyes. "She's right," he said to Braxton. "I know she's right. So stop looking at her like she's a variable you haven't accounted for." Braxton looked away from Nora. If he was bothered by the observation, he didn't show it. He moved toward the door. "I need to check on the footage. Riva should have it by now." He paused at the threshold. "Don't let him talk himself into anything." He left. Nora stood in the bay with Colonel Marcus Hale and the monitors and the specific quiet of a room where a great deal had happened and a great deal more was about to. She checked his blood pressure, better, not good, and adjusted his pillow angle by 3 degrees and said nothing. After a moment, Hale said, "How did you end up here? At this hospital?" "It was hiring. Out of everything you could have done." "It was what I wanted to do." She paused. "Still is." He was quiet for a beat. "And tonight?" She looked at him. "Tonight happened." He almost did the smile thing again. "Fair," he said again, the same word as before, with the same quality. The word of someone who had decided to accept an answer without pressing it because they respected the boundary it was drawing. Nora pulled the stool from the corner and sat down, because her feet had been going since midnight and she was no longer officially on shift, and she saw no reason to perform alertness. She didn't need to perform. She sat and watched the monitors and listened to the building around them. The new, reconfigured rhythms of a hospital floor that had been quietly militarized in the last 40 minutes without a single public announcement. She was thinking about the paramedics, the one who had angled away from the cameras, the boots. She was thinking about the drive in the jacket lining and who had moved it and whether they'd copied it or just confirmed it was there. She was thinking about the word Hale had said when he came back to consciousness. Lark. Not her name, not her current name, not her name as it appeared on any nursing license or employment record or lease agreement in Salt Lake City. A different name, from a different time, connected to a version of herself she had been specifically trying to not be for 3 years. And she was thinking about the fact that Marcus Hale had aimed it at the corner of the room without opening his eyes first, which meant he hadn't seen her and then recognized her. He had known she was there before he looked. Braxton came back at 3:04 a.m. with Riva behind him, and an expression that had undergone a significant revision since he'd left the bay. He came in and closed the door, actually closed it, which none of them had done since the situation started, and stood in the middle of the room and looked at both of them before he spoke. "The ambulance bay footage," he said, "the rig that brought him in. We pulled the plates." Nora waited. It's registered to a private medical transport company out of Ogden, contracted through the hospital's secondary dispatch system for overflow calls. He paused. The company has been operating for 14 months. The owner of record is a woman named Tessa Ballard. We ran her. She's clean. Small business, legitimate contracts, nothing unusual. But, Nora said, but the rig that brought Hale in tonight wasn't one of her vehicles. It was a matching unit. Same make, same model, same color, close enough on the livery that it passed the entry camera without flagging. Someone built a duplicate specifically for this run. The bay was quiet. That's not improvised, Nora said. No, Braxton agreed. It's not. It's not. Hale had both eyes open now. He was tracking the conversation with the focused attention of someone who was in pain and had decided that the pain was not currently the relevant variable. The Ballard Company, he said. Who holds the hospital contract? Procurement runs through the hospital's administrative office. Director-level approval. Everyone in the room arrived at the same place at the same time. Who's the hospital director? Nora asked. Braxton looked at her. A man named Gordon Stell. He's been director at Hargrove General for 6 years. He paused. I was also, according to the records we pulled on the way in, a medical logistics contractor for the Department of Defense for 4 years before he transitioned to hospital administration. Nora heard that and felt the specific, unpleasant sensation of a picture assembling itself faster than she wanted it to. Has anyone contacted Stell tonight? She asked. Deering called him when the helicopters landed. Standard protocol. Director gets notified of any major incident. Braxton's jaw was tight. So he knows we're here. He's known for over an hour. Hale pushed himself up onto his elbows. His face went white with the effort, and Nora put her hand on his shoulder without thinking. Not a restraining gesture, just a counterweight, something to push against. Don't, she said. Stell had access to the dispatch system, Hale said, not lying back down, but not fighting her either. If he's connected to the group that ran the Meridian Compromise, he would have known my transit route. He would have had the resources to build a duplicate rig and the administrative cover to route the call through a legitimate contract. He looked at Braxton. This wasn't external. This was someone inside the system who knew how hospitals work. We need to secure him before he moves, Braxton said. He turned to Riva. Get me his home address and send 2 people. Don't spook him. I want a soft approach until we have more. Riva left. Nora was doing the math. She was doing it fast, and it wasn't adding up to anything comfortable. A director with DoD procurement history who had access to the hospital's dispatch contracts and had been notified an hour ago that military helicopters had landed on his property. A man who, if Hale was right, had just learned that the thing he'd arranged to happen quietly had been interrupted. If he's connected, she said carefully, and he knows you're here, and he knows the patient survived, he knows the operation failed, Braxton said, which means he knows that everyone who touched this case is now a liability. The room went still. Nora looked at the bay window. The corridor outside was exactly as it had been. Braxton's team at their positions, the floor quiet, the hospital running its nighttime rhythms around the military presence that had restructured everything. But the window gave her a clear line to the nursing station, to the corridor beyond it, to the elevator bank at the far end of the hall, where one of Braxton's team was posted. The elevator bank where, at 3:11 in the morning, the indicator light had just lit up. Someone's coming down, Nora said. Braxton turned, looked. The elevator was descending, not from the lobby, from above. Upper floor. The indicator showed it passing 3, 2, then stopping at 1, the ER level. At 3:11 a.m., when visitor access was closed and the only people moving through the upper floors should have been overnight staff. The elevator doors opened. 2 men came out. They were wearing orderly scrubs, the pale blue of Hargrove General's auxiliary staff, and they were pushing a medication cart between them, and everything about their posture was wrong in a way that took about 1 second to read if you knew how to read it, which Nora did, and which Braxton did, and which the team member stationed at the elevator bank apparently did too, because his hand had already moved. But the orderly on the left moved faster. What happened next was loud and fast, and occupied approximately 12 seconds. And when those 12 seconds were over, Braxton's team member was on the floor with a taser wire trailing from his vest. He'd be fine, Nora assessed automatically, but he was out of the equation. And the 2 men in scrubs had abandoned the cart and were moving down the corridor toward Bay 4 with the specific directed purpose of people who had a single objective and had already decided that everything else was secondary. Braxton was out the bay door before Nora could say anything. Two of his other team members were converging from their positions. In the corridor, Nora heard the sounds of a fast, brutal, close-quarters confrontation that was over in under 30 seconds, she counted, and ended with both men in scrubs on the floor and Braxton's team member from the elevator helped to a seated position against the wall. The corridor went quiet. Nora stood in the bay door. Her heart was doing something loud, and she was making herself breathe evenly and steadily because there was a man behind her connected to monitors and an IV, and his heart rate had just spiked to 1 in 12, and she needed to deal with that. She turned back to Hale. Hale was upright on the gurney, not lying down, fully upright. And in his right hand, which had been empty and flat on the mattress 30 seconds ago, was a compact service pistol that she had not seen before this moment, and whose provenance she was not going to ask about. He met her eyes. "I'm a light sleeper," he said. She looked at the gun. She looked at him. "Where did that come from?" "Braxton's people are thorough, but they don't check the IV equipment housing." A pause. "Habit." She looked at the monitor. His heart rate was coming down. Adrenaline response, short duration, the body of someone who had been in enough situations like this that his system knew how to process them without sustaining the spike. "Your blood pressure just jumped 20 points, she said. "I know." "If you'd actually had to use that, I know, Nora." He said her name. Her actual name, her current name, not the call sign, and the way he said it was different from the way anyone at Hargrove General had ever said it, with a weight of familiarity that didn't come from 11 weeks of probationary nursing. It came from somewhere else entirely. She looked at him for a long moment. In the corridor, Braxton appeared in the bay doorway. He looked at Hale. He looked at the gun. He closed his eyes for approximately 1 second in the expression of someone who had just decided to deal with one thing at a time. "Both secured," he said. "Neither is talking yet." He looked at Nora. "Are you all right?" "Fine." "Good. Because I just got off the radio with my command." He paused. "Gordon Stell left his house 11 minutes ago. His car is heading toward the hospital." Hale's grip on the pistol didn't change. "He's coming to verify." "Or to finish it," Nora said. Braxton looked at both of them. At the colonel sitting upright with a gun on a hospital gurney at 3:15 in the morning. At the nurse who had been fired 4 hours ago standing at the foot of the same gurney. Reading monitors with the specific steadiness of someone who had been in worse rooms than this one. "I need both of you to stay exactly where you are," he said. He turned and started giving orders into his radio. Nora watched the corridor. She watched the elevator bank. She watched the hospital that had been, 6 hours ago, a place where she had a probationary contract and a locker with a code in it, and a life she had constructed carefully around the idea of being someone smaller and quieter than she actually was. She watched all of it, and she thought about Gordon Stell driving toward this building right now, knowing what he knew. And she felt the thing in her chest that she had been carefully managing for 3 years begin to shift into something that wasn't frustration and wasn't anger and wasn't quite fear. It was the feeling of a person who had been trying very hard to stay inside a life that no longer fit. And the sound of those elevator doors opening had just made the decision for her. Her phone buzzed. Unknown number. She looked at it, looked at Hale. "Are you expecting a call?" he asked. "No." "Answer it anyway." She answered. The voice on the other end was calm, unhurried, and belonged to a man she didn't recognize. He said 4 words before he hung up. 4 words that told her that whatever had happened tonight, the firing, the helicopters, the men in scrubs, the gun in the IV housing, was not the beginning of this situation. It was the middle, and the beginning had her name in it. She stared at the phone after the call ended. 4 words. That was all. Spoken in a voice that was unhurried and male and entirely without effect, the voice of someone who had made this kind of call before, and had learned that brevity was more frightening than elaboration. "We know about Lark." Hale was watching her from the gurney. He hadn't put the gun down. His blood pressure was still elevated and his color was still not good, and none of that was the relevant variable right now, and they both knew it. "What did they say?" he asked. She told him. He was quiet for 2 seconds. Then he said, "Give me the phone." "It was a burner. They're already gone." I know. Give it to me anyway. She handed it over. He turned it in his hand, looked at the call log, memorized the number even though it would go nowhere, and set it on the mattress beside him with the deliberate motion of someone adding a piece to a map they were building in their head. They've had your name for a while, he said. This wasn't improvised. I know. Which means the 3 years you've been here. I know, Marcus. He looked at her. It was a careful look, not pitying, which she appreciated. You've been running a civilian identity for 3 years and they found you anyway. Or they found you, she said, and followed the thread back. He considered that, nodded once, slowly, which was the acknowledgement of a man who was processing the possibility that his compromise had cost someone else their cover. She watched him add that weight to whatever he was already carrying and decide not to put it down. Braxton came back through the bay door at a pace that said the situation outside had developed. Stell's vehicle stopped 4 blocks out, he said. He's not coming in. He looked at Nora. What was the call? She told him. The same 4 words, the same lack of elaboration. Braxton's jaw moved. They know you're here. They knew before I answered, which means they have eyes on the building. He turned to the window, looked at the corridor, the geometry of the floor, the positions of his team. He was running the same assessment she was. She could see it. The systematic evaluation of a secured space that might not be as secured as it had appeared 60 minutes ago. I need to move him. You can't move him, Nora said. His pressure is still unstable. Transport in this condition risks a secondary event. Staying in this condition risks something worse. Moving him without stabilizing him first is how you lose him for good. She kept her voice level. You need 40 minutes. Let me work. Braxton looked at her. The look had a different quality now than it had had 2 hours ago. Not the evaluation of an unknown quantity, but the focused attention of someone who had revised their assessment and was operating on the new version. 40 minutes, he said. Then we move regardless. He left to reposition his team. Nora turned to Hale. I need you lying down. I know what you need. Lie down first and then we'll talk about what you need. He lay down. Not without argument. The argument was in the set of his jaw and the deliberate way he controlled the motion. But he did it, which told her something about him that she filed alongside everything else she'd been filing tonight. He knew when to trust someone else's expertise. That was rarer than it should have been. She worked quickly. She adjusted his IV flow, ran a manual pressure check that confirmed what the monitor was showing, and did a secondary assessment of the bruising on his left shoulder that she hadn't had the time or the lighting to do properly when he first came in. Up close, the pattern was even clearer than it had been from across the bay. The force distribution was specific and deliberate, and there was a secondary bruising pattern lower on his rib cage that she hadn't caught before. A second point of impact, smaller, more focused. There's a second contact point, she said. Lower left, below the 7th rib. He was staring at the ceiling. I know. Did they use 2 devices? 1. The second impact was something else. A pause. I hit a loading dock barrier when the first one went off. The blast threw me. How far? 12-15 feet. She palpated carefully along the rib. He controlled his breathing, but she felt the tension in the muscle beneath her hands when she hit the right spot. You've got at least 1 cracked rib, possibly 2. The X-ray will tell us, but you already know this. Yes. You've been breathing around it for the last 2 hours. Yes. She taped the area with the supplies available in the bay. Not a proper binding, not with internal trauma still possible, but enough to give the intercostal muscles something to work against. He didn't make a sound during the process, which wasn't toughness exactly. It was the specific discipline of a person who had made a decision about pain management and was executing it. The call sign, she said while she worked. How did you know it was still valid? He was quiet for a moment. It's always valid. She didn't ask what that meant. She thought she understood. When did they pull your comms implant? She asked. I don't know. I was unconscious when it happened. I didn't realize it was gone until... He stopped. Until you tried to use it and couldn't, she finished. Yes. She stepped back and checked the monitor. Pressure was 108/71. Still low but trending in the right direction. Heart rate at 94. The color in his face was better than it had been when he first opened his eyes, which wasn't saying a great deal but was saying something. She had 32 minutes left of the 40 Braxton had given her. That was when the lights went out. What's? Not a flicker. Not a partial outage. Full darkness, immediate and total, lasting approximately 4 seconds before the hospital's emergency generator system engaged and brought up the backup lighting, a dimmer, yellower illumination that turned the bay into something that looked like the inside of a held breath. The monitors stayed on. They were on the generator circuit. The IV pump stayed on. The fundamental equipment held. Everything else changed. Nora was at the bay door before the backup lights finished coming up, her hand flat on the frame, reading the corridor. Braxton's team was moving. She could hear it, the controlled reorientation of trained people adjusting to a compromised environment without waiting for orders. Someone called out a position check in a low voice. Someone else responded. Braxton materialized at her shoulder. Generator was cut at the external panel, he said. East side of the building. It's back up, but we have a 4-second gap in external camera coverage. 4 seconds was enough. How many entry points does this floor have? She asked. 6. We have 4 covered. She looked at him. He looked back at her and didn't say what they both understood, which was that 4 covered out of 6 meant 2 that weren't. From somewhere deeper in the hospital, not close but not far, she heard a sound that didn't belong to the normal acoustic landscape of a hospital at 3:30 a.m. Not an alarm, not equipment. Something percussive and brief, followed by a door hitting a frame hard. Then a voice in the corridor, one of Braxton's team. Contact north stairwell. Then 2 more sounds in fast succession that were not medical equipment. Nora turned back into the bay. Hale was already sitting up again, gun in hand, and she had the fraction of a second to think that she needed to not be angry about that right now, because being angry about it wouldn't help either of them. They're in the building, she said. How many? Unknown. She moved to the supply cart. Methodical, fast, not rushed. She knew this cart. She had stocked half of it herself during the 11 weeks she'd worked this floor. She knew what was on it and what wasn't, and what she could use and how. Braxton has 2 uncovered entry points. North stairwell is 1, Hale said. What's the other? Service corridor on the south end. It connects to the loading bay. She paused with her hands on the cart. The loading bay that has a direct external access from the east parking structure. Hale's expression shifted. The same side where the generator panel is. Yes. He was already processing the tactical picture. She could see it. The generator cut is a distraction and a camera gap, the north stairwell contact to draw Braxton's team north, and the real entry point south, coming in quiet, while the response was oriented the wrong direction. It was a competent plan. It was the plan of people who had looked at the floor layout before tonight. They have the building diagram, Hale said. Someone gave it to them. Stell. She didn't confirm it. She didn't need to. She picked up what she needed from the cart and moved back to the door. In the corridor, the sounds of the situation in the north stairwell were ongoing. Not a firefight, more like a pursuit, controlled and directional. Braxton's team was handling it, but Braxton's team was now oriented north. She looked at the south end of the corridor. The service corridor access was a door marked Authorized Personnel Only in red lettering that she had walked past 300 times in 11 weeks, and had filed in the back of her mind with the same automatic precision she'd filed everything else. The door was 12 inches open. It had been closed 20 minutes ago. She was certain of it. She turned to Hale. Can you walk? He looked at her steadily. Define walk. Move under your own power, 15 feet without losing consciousness. Yes. Then I need you off the gurney. Where are we going? Nowhere. I need you off the equipment and behind something solid before whoever just came through that service door reaches this end of the corridor. He moved. It was not graceful. His face went tight and pale with the rib pain, and she saw him absorb it and push through it in the specific, ugly, very human way that people push through things that genuinely hurt. He got off the gurney. She caught his left arm to steady him, and he took the assistance without comment, which was the right decision. She put him behind the crash cart in the corner, not because the crash cart was bulletproof, but because it was dense, it was wheeled, and it put 12 inches of steel and equipment between him and the bay window. She stayed at the door. Braxton's voice crackled on the radio that one of his team members had left on the nursing station counter when they'd repositioned. North contact is a diversion. 2 individuals, non-lethal approach, already restrained. Repeat, north contact was a decoy. The service corridor door opened fully. Two people came through. They were not wearing scrubs this time. They were in civilian clothing, moving fast and low, and the first one through was already oriented toward Bay 4 before he'd fully cleared the doorframe because he knew exactly where he was going. Nora stepped into the corridor. She did it without a plan beyond the immediate geometry of the situation, which was that the corridor was 12 feet wide and she was standing in the middle of it, and that was a different problem for them to solve than finding an empty hallway. The first man saw her and processed her as an obstacle. She watched the calculation happen, watched him decide she was civilian staff, watched him start to move around her. She didn't move around him. What she did next took 4 seconds and used 3 specific techniques that she had not used in 3 years, and that her body remembered with a completeness that was almost startling, the way you remembered a language you'd spoken fluently before a long silence. The first man went down and stayed down. The second had time to adjust his approach, and was larger and better trained, and the next 12 seconds were not clean or composed or anything like what got depicted in any medium that preferred its action sequences aesthetically pleasing. She took a hit to the left shoulder that would leave a bruise for a week. She used the wall. She used the supply cart. She used the specific knowledge of how a corridor worked as a tactical space when you were smaller than your opponent and fighting someone who had more raw mass than you and were trying not to kill anyone because this was a hospital, and these men were, in some sense, evidence. The second man went down. She stood in the corridor breathing hard, her left shoulder sending a specific and insistent pain signal that she was noting and setting aside. Both men were on the floor. She had dislocated the second man's shoulder, which was not something she'd intended precisely, but was a predictable consequence of the joint lock she'd used when he outweighed her by 60 pounds, and she'd needed the leverage. He was conscious and in significant pain and not going anywhere. She looked down at her hands. They were shaking slightly. Not from fear, from adrenaline depletion, the normal physiological response, the thing that happened to everyone after the fact. Very human, she thought, and not particularly convenient. Braxton came around the corner from the north end of the corridor at a run and pulled up short when he saw the 2 men on the floor and Nora standing between them with her back against the wall. He looked at the men. He looked at her. He looked at her hands. She put them in her pockets. Service corridor, she said, came through the south access. The north contact was the decoy, like you said. Braxton stared at her for a moment longer than was strictly necessary for processing what she'd said. Then he turned and called 2 of his team to come secure the men on the floor. She went back into the bay. Hale was still behind the crash cart. He had the gun up and had apparently had a clear line on the corridor through the bay window during the entire sequence of events, which she decided to also not address right now. "You're bleeding," he said. She looked at her left forearm. The second man had been wearing something with a buckle that had caught her during the struggle, a clean cut, not deep, about 2 inches long. She hadn't felt it happen. "It's minor," she said. I know what it needs." She went to the supply cart. She cleaned and dressed the cut herself with the focused efficiency of someone who had done field dressing on worse things than this, in worse places than this, and she did it in under 90 seconds without needing to think about any of the steps. When she finished, she looked up and found Braxton in the doorway. He was looking at her with the expression of someone who had finally run out of revisions to their assessment and had landed on the version they were going to keep. "Who are you?" he said. Not the same question he'd asked before. The same words, different question. The first time he'd asked it, he'd been testing. This time he was asking because he genuinely needed the answer and had decided he'd earned it. She looked at Hale. Hale looked back at her. "Tell him," Hale said. She turned back to Braxton. She thought about the 3 years and the careful construction and the apartment in Salt Lake City with the books on the shelf and the nursing license on the wall and the version of herself she had been living. She thought about the phone call and the 4 words and the fact that the door to that life had been closing for the last 3 hours, whether she chose it or not. "My name before Nora Voss," she said, "was different. I operated under the designation LARC for a Joint Special Operations Intelligence Unit called the Kestrel Program. We worked asset protection and extraction in high-risk environments. I was their medical specialist." She paused. 3 years ago, I was pulled from active status and given a civilian identity after a compromise that I was told was resolved. Braxton was very still. "It wasn't resolved," she said, "or it was resolved badly. Because whoever made that call tonight knows the name LARC. The Kestrel Program. Braxton said carefully. That's a black program, compartmentalized above my clearance level. Yes. How did Hale know you? Marcus ran asset coordination for 2 of our operations. She glanced at Hale. We worked together under conditions I'm not going to detail in a civilian hospital. Braxton absorbed this. She watched him work through the implications, the black program, the civilian cover, the 3 years. The way she'd read Hale's injuries when he came in. The way she'd handled 2 trained men in a hospital corridor. The people who tried to kill Marcus tonight, he said slowly, may have known about you before they pulled his communications implant. They may have routed him to this specific hospital because they knew you were here. The room was quiet. She had thought of this. She had thought of it at 2 a.m. when she was standing in the parking lot watching the helicopters land, and she had set it aside because the immediate situation required her attention. But she had thought of it. If they routed him here deliberately, she said, then they wanted both of us in the same place. Why? Because whatever Marcus has on that drive, she said, requires context that only I can provide. She looked at Hale. That's it, isn't it? The drive isn't complete without something I know. Hale met her eyes. In his expression was the specific quality of a man who had been waiting for someone to arrive at a conclusion he'd already reached. The Kestrel program ran parallel operations to Meridian Station, he said. The data on the drive documents the compromise of both. Without the Kestrel operational logs, the Meridian data is incomplete. And the Kestrel logs are in my head, Nora said, because I memorized them before I went into civilian cover. Standard protocol. Yes. The silence that followed was the particular silence of a room where the shape of the situation had just become fully visible. Braxton looked between them. So they needed you both here, together, and they needed you dead before you could pass the information to anyone else. Or before we could pass it together, Hale said. The combination is what's dangerous to them. Outside the bay, one of Braxton's team was speaking rapidly into a radio. The 2 men Nora had put on the floor were being secured and searched. The hospital floor had the charged, overextended quality of a space that had been through several cycles of crisis in the last hour and was not done. Braxton's radio crackled. He listened, and his expression shifted into something that Nora had not seen on his face before. Not alarm, which was too dramatic, but the controlled recalibration of someone receiving information that changes the geometry of everything. He lowered the radio. He looked at both of them. Gordon Stell's vehicle was just found 3 blocks from here, he said. Engine running, empty. He paused. There's blood on the driver's seat. Hale's jaw tightened. He's not running, Nora said. Someone silenced him. Which means whoever is running this doesn't need him anymore, Braxton said. Which means they've moved past the phase where loose ends were an option and into the phase where... His radio crackled again. A different voice this time, shorter message, 3 words. Braxton's face did something she hadn't seen it do before. Not quite fear, something more controlled than fear and more serious. What? Hale said. There's a 3rd team, Braxton said. We missed a 3rd team. He looked at Nora. They're not on this floor. She understood before he finished the sentence. She was already moving toward the door. They're in the building, he said. Pediatric wing, 3rd floor. They have 11 people, staff and patients. He looked at her. They're asking for you by name. Not Nora, Lark. She stopped in the doorway of Bay 4 and stood there for 1 second, one full breathing second, and felt the last distance collapse between who she had been trying to be and who she actually was. She turned back and looked at Hale on the gurney. He was pale and cracked and had a gun in his hand and was looking at her with the expression of someone who already knew what she was going to do and had already decided that arguing about it would be a waste of both their time. Stay on the monitor, she said. Don't move unless you have to. Nora, I'll be back. She looked at Braxton. Tell me the layout of the 3rd floor, she said. And the woman who had spent 3 years being very small and very careful and very far inside the lines she'd drawn for herself walked out of Bay 4 toward the stairwell, and the hospital corridor stretched ahead of her under the yellow emergency lighting, and somewhere above her, 11 people were waiting for someone who had a different name than the one on the badge she no longer had. She took the stairs 2 at a time. On the 2nd floor landing, her radio. Braxton had pressed his team member's spare unit into her hand as she passed him, without being asked, crackled once. A voice. Calm. The same voice from the phone call. Look, we've been waiting. She didn't answer. She kept climbing. What she didn't know yet, what none of them knew, what was sitting in a file in a secure server in a building she hadn't thought about in 3 years, was that one of the 11 people on the third floor was not a hostage. The third floor smelled like antiseptic and recycled air and the particular staleness of a ward that had been locked down without warning. Nora came through the stairwell door low and fast and stopped with her back against the wall before the door finished closing behind her. She gave herself 3 seconds, not because she had 3 seconds to spare, but because 3 seconds of correct assessment was worth more than 30 seconds of movement in the wrong direction. The pediatric ward at Hargrove General was a straight corridor with patient rooms on both sides, a nursing station at the center, and a family lounge at the far end near the west window. The corridor was 40 meters long. The emergency lighting turned it into a tunnel of yellow shadow with hard edges and bad depth perception, the kind of environment that was worse for the person who knew the space than for the person who'd studied the blueprint, because familiarity created assumptions, and assumptions got people killed. She didn't make assumptions. She listened. 2 voices, far end of the corridor, male, not agitated, controlled, which was worse, which meant they were professionals rather than opportunists. The sound of someone crying, muffled, behind a closed door to her left. A child. Young, maybe 4 or 5 years old by the pitch. The crying was sustained and rhythmic, which meant fear rather than pain, which meant the child hadn't been hurt yet was doing a lot of work in that sentence. She counted the doors on each side, 8 rooms. At least 4 appeared occupied based on the lighting under the doors. The nursing station in the center had a light on, not the emergency system, a portable lamp, the kind that staff kept in supply closets for power failures. Someone had set it up deliberately. Sitting at the nursing station, visible from her position, was a woman she didn't recognize. Civilian clothing, mid-40s, short gray-streaked hair. She was facing the corridor with her hands flat on the desk in the specific posture of someone who had been told not to move and was complying because the alternative had been demonstrated to be worse. Not a hostage. Nora had said it to herself in the stairwell, and she said it again now, silently. One of the 11 people on this floor was not what they appeared. The phone voice had said they were waiting for her. That required information. Information required a source inside the space. She moved. The first 12 feet were straightforward, empty corridor, nothing between her and the first room on the right. She checked the door, unlocked, slightly ajar, the room beyond it dark and apparently unoccupied. She filed it. Moved to the second room. This one had a light under the door and the sound of quiet adult breathing, a parent maybe, sitting with a sick child in the dark. She kept moving. At the edge of the nursing station, she stopped. The woman with the flat hands on the desk had heard her. She could see it in the slight change in the woman's shoulder posture, the held breath, the eyes that didn't move to track sound because she was afraid of drawing attention to it. Nora stepped into the station's light. The woman looked at her. Her expression was complicated, relief and fear at the same time, the face of someone who wasn't sure whether the arrival of a new person was a solution or a new problem. "How many?" Nora said. Very quiet. The woman held up 4 fingers, then pointed toward the far end of the corridor, then held up 2 more. 4 at the far end, 2 somewhere else. 6 total in the immediate space, which meant the rest were either covering exits or distributed differently than Braxton's team had estimated. Nora held up 1 finger, pointed at the woman, pointed at the floor. "Stay. Right here. Don't move." The woman gave a single tight nod. Nora moved past the station toward the family lounge. She got 12 more feet before the voice came. Not the radio, not the phone. An actual voice, 10 feet ahead of her, stepping out of a doorway she hadn't reached yet. "That was faster than we expected," the man said. He was average height, average build, the specific kind of forgettable that was itself a trained quality. He was holding a phone, not a weapon, which told her that the weapon was somewhere accessible but not in his hand, which told her something about how he expected this conversation to go. She stopped. "We thought Braxton would try to talk you out of coming up," he said. "You came anyway." He tilted his head slightly. "That tells us something useful." "Where are the patients?" she said. "Safe, for now." His tone was conversational, the tone of someone who had rehearsed this. "We need 20 minutes of your time. You give us what we came for, and everyone on this floor goes home." "What did you come for?" "You know what we came for." He looked at her steadily. "The Kestrel logs, the operational timeline, and the source identification data from the Halcyon series. You carried it out in your head when you went into civilian cover." He paused. "We just need the names." She looked at him for a long moment. Behind him, she could now see the layout of the family lounge, a large open space with chairs arranged along the walls, and a window at the far end that was currently covered with a pull shade. 3 adults were seated along the left wall, 2 children on the right. A staff member, nurse, by her clothing, was seated separately near the window. 6 people, all looking at Nora. "Who sent you?" she said. "That's not relevant to your decision." "It is to mine." He looked at her with the patient expression of someone who had prepared for a longer conversation than he wanted to have. "Lark, you're one person. Braxton's team is 4 floors down, managing 2 separate incidents we created for exactly this purpose. You have no backup in this corridor, and we have 6 people distributed across this floor." He said it without menace, as a statement of facts. "You're going to give us the names." She was doing several things simultaneously. She was listening for the 2 people stationed elsewhere on the floor, building their position from the sound of their absence, the places the acoustic landscape went dead, the angles that were covered, and the angles that weren't. She was tracking the nurse seated near the window, who had not moved and had not looked at any of the other hostages, and whose breathing had a quality that was different from the frightened, shallow breathing of the people around her. And she was deciding how much to let this man talk before she stopped letting him talk. "The Halcyon names," she said. "You're running an extraction for someone who needs those names before the Meridian data goes to a federal oversight committee." Something shifted in his expression. Small. He'd been told she was smart, but being told something and encountering it were different. "Who's presenting the Meridian data?" she said. "And when?" He didn't answer. "Because if the committee session is already scheduled, you're on a deadline, which means this—" She looked around the corridor, at the lockdown ward, at the children in the lounge. "Was your last option, not your first." She looked back at him. "Which means the softer approaches already failed. Which means Marcus survived something that should have killed him. And you're out of time, and you came here with 6 people and a phone instead of with what you actually needed." A pause. "You don't have what you came for," she said. "You have a position, not a plan." The man's jaw moved. "I have 11 people on this floor." "You have 6, she said, "and one of them is yours." His expression changed. She moved. She went left, not forward, which was the direction he didn't expect because it took her toward the patient rooms rather than toward the lounge or away from him. The gap she'd seen in his coverage was along the room side of the corridor, the angle his people had left open because they'd planned for her to come down the center and engage at the lounge. She went through the second door on the left, through the dark patient room beyond it, and out the connecting door into the room adjacent, which brought her out on the other side of the man in the corridor, and behind the 2 people she'd identified as the secondary positions. The next 90 seconds were not linear. They were a series of decisions made faster than conscious processing, each one building on the physical geometry of the space and the position she'd mapped and the specific, unglamorous reality of close-quarter situations in small rooms. Things got broken. People made sounds they didn't intend to, and the outcome depended less on any individual moment of skill than on who had the clearest picture of the whole space at the start. She had the clearest picture. When it was over, she was in the corridor again, breathing hard, with a split across her right knuckles that was going to be stiff in the morning, and 2 more people on the floor behind her. She had not used the firearm Braxton had offered her when she left Bay 4. She had been in a hospital with children on the floor above her, and she had made a decision about that before she came through the stairwell door. Decisions had consequences. Her right hand was one of them. The man with the phone was still in the corridor. He had moved since she'd disappeared. He was positioned differently now, and he had the weapon out, which changed the geometry. I was covering the lounge entrance, which meant his priority had shifted from extraction to containment. He was afraid, not showing it. But she could read it in the changed angle of his shoulders, the way the gun hand was slightly higher than it needed to be. "You have 2 people left," she said, from the doorway to her right. The nurse in the lounge and one more position I haven't located yet. He turned toward her voice. You're going to get someone killed. The nurse in the lounge is your person, she said. She hasn't looked at any of the hostages once. She's been positioned near the window the whole time. She has a sight line to the exterior of the building. She's a spotter. She paused. If I'm wrong about that, call her name and ask her to move away from the window. He didn't call anyone's name. Then we both know I'm not wrong, she said. He made the decision fast, which was the thing about genuinely trained people. They didn't spend time on decisions that were already made. He moved toward the lounge. She moved faster. She came through the lounge doorway a step ahead of him and said, loudly and clearly, to the room, Everyone down, floor, now. The hostages dropped. All of them, immediately, without hesitation, the universal human response to a clear instruction delivered with enough authority at the right moment. The children went down with their parents. The adults folded to the floor and covered their heads. The nurse by the window did not go down. She moved instead, toward the window, reaching for the shade pole, which would signal the exterior position that something had changed. Nora reached her before the shade moved, and the brief, sharp exchange that followed was not something Nora would have been comfortable with in any other context, because the woman was capable and committed, and the outcome was not as fast or as clean as Nora would have liked. But the shade stayed closed. The man with the phone came through the lounge door and stopped when he saw the nurse on the floor and Nora standing over her, and he processed the situation for exactly the 2 seconds it took for Braxton's team to come through the lounge's second entrance, the service door near the window that Nora had radioed the location of while she was moving through the patient rooms. 2 seconds was not enough time. It was over in the lounge. The man with the phone went to the floor without the gun, which was the first smart decision he'd made in the last 4 minutes. Nora straightened up. Her breathing was loud in the sudden quiet. Her right hand was bleeding from the split knuckle and her left shoulder was a sustained, insistent ache, and she was going to need to sit down in approximately 10 minutes, whether she wanted to or not. She looked at the people on the floor, the hostages, huddled and shaking, the children beginning to cry in the specific delayed way that children cried after danger had passed and their bodies had finally gotten permission to respond. A small boy, maybe 5, had his face pressed against his mother's shoulder and was shaking so hard Nora could see it from across the room. She crouched down to his level. Hey, she said, quietly. It's done. You did so well. He looked at her from the shelter of his mother's arms with enormous wet eyes. We're okay now? He asked. You're okay, she said. I promise. She stood up before she let herself feel anything about that exchange, because feeling things had to wait, and she had learned the waiting a long time ago, and she was very good at it. Braxton appeared at her shoulder. He looked at her knuckles. He looked at the nurse on the floor, now secured, and the man with the phone, and the third team member who'd come through a storage room door at the wrong moment and had met 2 of Braxton's people instead. Third team neutralized, he said into his radio. Then he looked at her. You couldn't wait for backup? You were 4 floors down. I was 90 seconds out. There were children, she said. He held her gaze for a moment. Then he turned away and didn't argue, which was the right decision. They brought everyone back to the ground floor at 4:10 a.m. The man with the phone, whose name, extracted with professional efficiency by Braxton's people in the hour that followed, was Raymond Voss, no relation. The coincidence was what it was, had been hired through a private security contracting firm called Helion Group that operated out of 3 cities and did work it called risk mitigation, and that Braxton's team called something with more precise and less flattering terminology. Raymond Voss talked. Not immediately, not without encouragement, but he talked, which was the thing about people who took jobs without fully understanding who they were working for. When the operation collapsed, their loyalty to the client collapsed with it because the loyalty had always been transactional. Helion Group had been contracted by a man named Douglas Faraway. Nora heard the name and felt nothing at first, just the flat, factual reception of new information. Then the context assembled around it, and she felt something that was not nothing. Douglas Faraway was the Deputy Director of Logistics and Coordination for the classified Kestrel program. He had been her supervisor for 18 months before she went into civilian cover. He had personally authorized her identity package and her relocation to Salt Lake City. He had put her there, and he had sent people to kill her there. She was sitting in the ER waiting room, cleared of civilians, temporarily repurposed as a staging area. when Braxton came and told her. He sat down across from her rather than standing, which she noticed. He had a cup of coffee in each hand, and he put one on the seat beside her without asking if she wanted it. She picked it up. It was terrible hospital coffee. She drank it anyway. Faraway has been running a parallel operation inside the Kestrel structure for at least 3 years, Braxton said. The Meridian compromise wasn't external. He engineered it. The drive Marcus was carrying has 300 pages of documentation: procurement fraud, unauthorized asset exposure, payments to foreign cutouts. He paused. The Halcyon series you were part of. He sold the source identifications from those operations to a private buyer. 5 people died because of it. She knew about 3 of the 5. She had not known about the other 2 until this moment. She sat with that for a moment. She let it be what it was. He put me into civilian cover because I was the only person who could identify the discrepancy in the Halcyon records, she said. I saw something that didn't add up 2 weeks before I was pulled. I flagged it internally and nothing happened. She paused. He made me disappear so I'd stop looking. Yes. And when Marcus started building the Meridian case and the evidence started pointing back toward Kestrel, Faraway needed both of us gone before the committee session. The session is in 36 hours, Braxton said. Federal oversight, joint committee. If the Meridian data gets presented without the Kestrel connection, Faraway survives. He's been sanitizing his footprint for months. The Meridian evidence alone doesn't name him specifically. He met her eyes. The Kestrel logs in your head do. She drank more bad coffee. He's been in this city before tonight, she said. It wasn't a question. We think so. We think the surveillance on your cover identity started about 8 months ago, after Marcus's investigation crossed into Kestrel territory. He paused. You've been watched for 8 months, Nora. She thought about 8 months of ordinary life, the commute to Hargrove, the grocery store on Saturdays, the apartment with the books, and the nursing license on the wall. 8 months of being watched by someone who had decided she was a liability and was waiting for the right moment to act. He waited until Marcus surfaced, she said. He needed us both at the same time. Yes. That means he still doesn't know whether the drive and the Kestrel logs together are enough. He's afraid of what we have when it's combined. She set down the cup. Which means there's something in those logs I haven't identified yet. Something bigger than what I know I have. Braxton looked at her carefully. We need you to go through them. All of them. Everything you carried out. Tonight, before the committee session, because if Faraway knows his operation here failed, he already knows, she said. Stell is dead. The third team is contained. He knows. Then he's moving to contingencies. She stood up. Her left shoulder made its opinion of this known. Her right hand had been wrapped by one of Braxton's team members in a field dressing that was competent but not elegant, and the skin across her knuckles was tight and unhappy. She was tired in a way that went past the physical. The specific exhaustion of a person who had been trying to be one thing for 3 years and had spent one night being another thing entirely, and now had to decide which version they were going forward. I need to check on Marcus first, she said. He's stable. His pressure's been holding for the last hour. I need to see it myself. Braxton didn't argue. They went back to Bay 4. Hale was awake. I was lying down. Actually lying down, not pretending to, which meant the pain had won the argument that Nora hadn't been able to win with words earlier. His blood pressure on the monitor was 114/73, which was the best it had been all night. His oxygen was sitting at 97. His heart rate was 82. He looked at her when she came in, at her hand, at her shoulder, at the general condition of her, which she was aware was not impressive. Faraway, he said. Yes. She sat on the stool. How long have you known? 6 weeks, maybe 7. He shifted slightly against the pillow. The Meridian documentation kept pointing at the logistics layer. Faraway's fingerprints are in the procurement records, if you know what format his authorizations use. He paused. I flagged it to Braxton 4 weeks ago. You didn't flag it up the chain. No, because the chain goes through Kestrel coordination, which goes through Faraway. He looked at the ceiling. I've been building the case from outside the normal reporting structure. That's why the drive matters. It's documented proof that doesn't require anyone inside the system to validate it. And the Kestrel logs. Yours are the only complete set that wasn't controlled by Faraway. He purged the institutional copies 8 months ago. A records maintenance issue according to the official notation. The corner of his mouth moved. Very convenient. She understood the full picture now. All of it, assembled and complete. Faraway had purged the records. He'd watched her from a distance. He'd waited until Marcus got close enough to become a threat, and then he'd moved against both of them simultaneously, routing Marcus to her hospital, intending for him to die quietly and for her to be silenced in a way that looked incidental. And it had almost worked. It had almost worked because of 11 weeks. Because of a probationary nursing contract and a restricted bay, and a doctor who told her to stay out, and an administrator who fired her for not staying out. If she'd stayed out of Bay 4 at 1:47 a.m., Marcus Hale would have died on that gurney, and Gordon Stell's death certificate would have read natural causes, and the Meridian data would have gone to a committee session without the Kestrel connection, and Douglas Faraway would have walked away clean. She had not stayed out. She sat in Bay 4 at 4:30 in the morning and let herself feel the full weight of that sequence and what it meant, and she felt it, and then she set it aside. "I'm going to go through the logs," she said. "Everything I carried out. Every name, every date, every authorization code. I'm going to give Braxton everything I have, and he's going to get it to the committee before the session. It'll take hours. Then I should start." He looked at her for a moment. "And after?" She didn't answer immediately. She checked his IV line. She checked the tape on his ribs. She did the small, necessary things that were her job, or had been her job until 2:26 a.m., when Paul Deering put her badge on his desk. "I don't know yet," she said honestly. "I'll figure that out when it's done." He accepted this. Faraway will run. When he knows the committee has the full package, "He won't run," Braxton said from the doorway. He had his radio in his hand, and his expression had undergone another of its revisions. "He can't." They both looked at him. "We just got a location on Faraway," Braxton said. "He's been in Salt Lake City for 6 days. He paused. "He's been running the operation personally." Nora absorbed this. "He came here himself." "Yes." "That means he wasn't confident the contracted team would succeed. Or he needed to be present for something that happens after," Hale said from the gurney. His voice was sharper now, alert in the way that cut through the pain. "If the operation succeeded and we were both dead, he needed to be here to retrieve something. The drive. Or the logs. Or both." "He's still in the city," Nora said. "Yes," Braxton said, "and he knows his teams have failed." He looked at her directly. "We have a location. I have a team ready. But Faraway is former special operations. He ran field operations for Kestrel before he moved to deputy director. He will not be taken easily." He paused. "And he has one card left." "What card?" Hale said. Braxton looked at Nora. "He had a fourth team," Braxton said. "We missed it in the count, the same way we missed the third. It's not on this floor. It's not in this building." He held her eyes. "He has one person, someone he's been holding as contingency for the last 6 days." He paused. "Someone connected to you." Nora felt the room change. "Who?" she said. Braxton looked at the floor for a moment, the specific look of someone who had bad news and was deciding how to deliver it. Then he looked up. "Her name is Dana Voss. She's your sister. She lives in Portland." He paused. "She landed at Salt Lake City Airport 3 days ago. We don't know why she came here, but Faraway's people met her arrival." The bay was completely quiet. Nora stood very still. She thought about Dana, 4 years younger, a teacher, entirely uninvolved in anything Nora had ever done, entirely unaware that the sister she thought she knew had lived a different life under a different name. Dana, who sent texts on Sundays and called on birthdays, and had visited Nora's Salt Lake apartment twice in 3 years, and thought her older sister was quiet and a little distant because of things she didn't understand yet. "How long has he had her?" Nora said. Her voice was steady. She made it steady. "Unknown. At least 48 hours based on her last cell activity." She looked at Braxton. "Is she alive?" "We believe so. A live hostage is his only leverage now that his operational teams have failed. He needs her as a negotiation asset." Nora nodded once. The nod was small and contained everything it needed to contain and nothing else. She turned to Hale. He was looking at her with an expression that had no performance in it, just the direct, unmediated attention of someone who understood what she was carrying and was not going to insult her by saying anything that minimized it. "Go," he said. She turned to Braxton. Give me everything you have on his location. Nora, he's been 6 days in this city, she said. He's been running this operation from somewhere. He's not in a hotel. He'd want a controlled space, something with multiple exits, something he chose in advance. She looked at Braxton. He spent 18 months supervising my program. He knows how I think. He would have picked something that he believed I wouldn't choose. Which means what? Which means he picked somewhere obvious, she said. Somewhere I'd dismiss because it was too exposed. Somewhere that looks like a liability but functions as a strength, because everyone would assume he'd avoid it. She paused. He's been doing this long enough to know that the most counterintuitive option is usually the right one. Braxton looked at her for a long moment. I have an address, he said slowly. We flagged it an hour ago but dismissed it because it's too central. It's 4 blocks from the hospital. He paused. It's a medical office building, 7 floors, 24-hour lobby access. She was already moving toward the door. Nora, Hale said behind her. She stopped. He's expecting you, Hale said. That's what the phone call was. The 4 words. He wasn't warning you. He was directing you. He wanted you to know he had your name so that when he took your sister, you'd come straight at him. She stood in the doorway. I know, she said. He'll have the building prepared. I know that too. Then he should have prepared for the version of me that's been up since midnight, lost her job, taken 3 separate hits, and has nothing left to protect except one person. She looked back at him. That version doesn't make the same decisions as the careful one. She walked out of Bay 4 for the second time that night. Behind her, in the corridor, she heard Braxton speaking rapidly into his radio. She heard Hale saying something she couldn't make out. She heard the hospital, her hospital, the place she'd spent 11 weeks trying to be ordinary, running its late-night rhythms around a situation that had stripped away everything ordinary in the space of 3 hours. She heard all of it, and somewhere in a medical office building 4 blocks away, Douglas Fairway was waiting for her with a hostage and a plan, and the absolute certainty that he knew which Nora Voss was coming through the door. He was wrong about that. He had been wrong about her from the beginning. She just hadn't had the chance to show him yet. The medical office building at 4th and Callaway had a glass lobby, a security desk that was unmanned at this hour, and 7 floors of darkened offices that looked, from the street, like exactly what they were supposed to look like. That was the point. Nora stood half a block away in the shadow of a parking structure overhang and looked at the building for 90 seconds before she moved. Braxton was beside her with 2 of his team. The other 2 were covering the rear access and the parking level below grade. They had the address. They had the rough floor count. They had Raymond Voss's partial account of the building's use, extracted in the last 20 minutes, which gave them the 6th floor as the most probable operational position and told them nothing about what Fairway had done to prepare for her arrival. He has 1 exit he thinks we don't know about, Braxton said quietly. Service tunnel runs under the building to the parking structure 2 blocks east. Voss mentioned it. Fairway knows Voss talked, Nora said. He'll have already written that exit off. So he's not planning to run. No. She looked at the lobby. He's planning to trade. She was cold. The February air had been working on her for the last 20 minutes of standing and moving, and she had left her coat in the hospital locker, and she had not thought about it once since midnight, and she was thinking about it now only because her body was making an accounting of its current inventory of complaints, and the cold had joined the left shoulder and the right hand, and the general accumulated cost of the last 4 hours. She stopped thinking about the cold. If I go through the front, he sees me coming, she said. If I go through the service access, he expects it. Either way, he has time to do something I won't like with Dana. Then what do you suggest? She looked at the building again, at the lobby layout, at the security desk, unmanned but lit, at the elevator bank visible through the glass. The fire suppression system, she said. Does your team have access to the building's utility panel? Braxton looked at her. Not the alarms, she said, just the suppression. If the sprinkler triggers on 1 floor, the elevator system automatically locks and defaults to ground. She paused. It takes 45 seconds for the building management system to respond and override. 45 seconds where every elevator in the building is sitting at the lobby level with its doors open. He'll hear it. Yes. And he'll make a decision based on what he thinks is happening, which is that we're trying to flush him down. He'll hold position. She looked at Braxton. While he's holding position, I'll be on the stairs. Braxton was quiet for a moment. I was running the same calculation she was and arriving at the same uncomfortable answer, which was that the plan had merit, and also significant risk, and also was probably the best option available at 4:45 in the morning with a hostage on the sixth floor and a man who had spent 20 years in operational intelligence, preparing for exactly this kind of approach. "Give me 3 minutes," he said. He got on his radio. She stood in the shadow and looked at the building and thought about Dana. Dana, who was 4 years younger and who had their mother's eyes and who had, when Nora went into civilian cover, accepted the explanation of a career change and a need for distance with the specific grace of someone who loved their sister enough to not push. Dana, who had texted her 2 weeks ago a photo of a sunset over Portland with no caption, just the image, the way she did sometimes when she wanted Nora to know she was thinking of her without requiring a response. Nora had sent back a single emoji, the small yellow sun. She thought about that. Then she stopped thinking about it, because thinking about it required accessing things she couldn't access right now and still function at the level the next 30 minutes demanded. "Ready," Braxton said. She went through the lobby door at 4:47 a.m. Wow. The stairwell was dark except for the emergency strip lighting at floor level, a thin red line along the bottom of each step that turned the ascent into something that looked like the inside of a slow alarm. She took the stairs at a controlled pace, not running, because running up 6 floors produced a breathing pattern that was audible and a heart rate that was not useful, and she had learned this in a different stairwell, in a different building, in a different life, and the lesson held. On the 3rd floor landing, she heard the sprinkler system engage above her, a distant hiss, then the building's ventilation shifting to accommodate the pressure change. The elevator mechanism clunked through the walls, the shaft system responding to the suppression trigger. 45 seconds. She climbed. 4th floor. 5th. The sounds of the building reconfiguring around the suppression event were cover. Not much, but enough to mask the specific acoustics of a person on stairs, the footfall, the breathing, the occasional brush of a hand against the railing that she controlled but couldn't entirely eliminate. 6th floor door. She stopped, her hand on the bar. Listened. Voices on the other side. 2. One was Faraway. She recognized the measured cadence of it, the voice of someone who was very accustomed to being the most controlled person in any room. The other was female and lower, strained, the voice of someone who was keeping themselves functional through effort rather than calm. Donna. She pushed through the door. The 6th floor was an open-plan office space, a financial services firm based on the branding still on the walls, temporarily vacated and temporarily repurposed. The furniture had been moved to create clear sightlines from the central position to all the entry points, which was methodical, and told her that Faraway had spent time on this. The overhead lighting was off. 3 portable lamps were positioned to illuminate specific zones while leaving others in shadow, which was also methodical, and told her that the lighting arrangement was designed to disadvantage someone entering from any of the standard access points. She had come through the stairwell on the northeast corner. The lamps were covering the northwest stairwell, the elevator bank, and the south service corridor. She was standing in the one shadow he hadn't lit. Douglas Faraway was 51 years old. He was seated at a desk positioned in the center of the space with his back to the window. Never your back to the window, she thought, and then corrected herself because he had chosen that position deliberately, because the window behind him was the only thing in the room she couldn't look at directly without the exterior lighting creating a contrast problem. He knew exactly what he was doing. Dana was in a chair 6 feet to his left. Her wrists were zip-tied to the arms of the chair. She had a cut above her left eyebrow that had dried into a dark line, and her eyes were open, and when she saw Nora come through the northeast door, something crossed her face that Nora had no word for and would not try to find one. Faraway saw Dana's expression change and turned. He looked at the northeast corner. He found Nora in the shadow. His face did something that was not surprise. It had moved past surprise at some point and settled into the particular expression of a man who was calculating his remaining options with the focused attention of someone who was very good at this and was not yet ready to accept that there were no remaining options. "You came through the wrong door," he said. "I came through the one you didn't cover," she said. "That's not wrong. That's just accurate." He looked at her for a moment. He was assessing the same things she had assessed about him. The condition she was in, the number of people she'd visibly brought with her, the angles. "You're alone. For now. Braxton's team is covering the exits." "Yes." "Then we have a few minutes to talk," he said, "before this becomes something more complicated than it needs to be." She looked at Dana. Dana's jaw was tight and her eyes were dry, which took a specific kind of effort, and Nora felt a complicated surge of something that was partly pride and partly the particular grief of recognizing a strength in someone you love that they should never have needed. "Let her go," Nora said, "when we've finished our conversation. Let her go and then we'll have a conversation." He leaned back slightly in the chair. It was a performance of ease that he'd been doing for 20 years, and he was very good at it. "The Kestrel logs," he said. "I need the Halcyon source names. 3 names. That's all. You give me those and your sister walks out of this building, and I give myself up to Braxton's team, and this ends without anyone else getting hurt." She looked at him steadily. "You're going to give yourself up either way." "But the manner of it matters," he said. "If I'm in custody with those 3 names, I have leverage. Leverage means a negotiated arrangement rather than a federal cell for the rest of my life." His voice was still even. "This is transactional, Nora. You of all people should understand that." "I understand that you sold 5 people's identities to a private buyer," she said, "and 3 of them died because of it. And you've spent 3 years watching me from a distance, waiting to decide whether I was useful or a liability." She paused. "I understand all of that very clearly." Something moved in his expression. Not guilt. She didn't think Faraway had a mechanism for guilt left in any functional sense. Something more like the recognition of a person who was being seen accurately and disliked the experience. "The names," he said. "You know I won't give them to you." "Your sister, you're not going to hurt her," Nora said. "Not because you have limits, but because she's the only leverage you have. And the moment she's hurt, she stops being leverage. You're too smart to destroy your last asset." She took 3 steps into the room, moving out of the corner shadow but staying out of the lamp zones. "You've been planning for the version of me that's careful, that thinks 6 moves ahead, that weighs options." She looked at him directly. "I stopped being that person about 3 hours ago." He looked at her, really looked. The full assessment, the version of it that had nothing performative in it. He was looking at the split knuckles and the wrapped shoulder and the accumulated evidence of a night that had taken things from her that he hadn't calculated for when he'd built this plan. For the first time, Douglas Faraway looked uncertain. He stood up from the desk, and Nora moved. She went left, not toward him, toward Dana. The priority was always Dana. If Faraway moved on Dana before she reached her, everything else became secondary to that outcome. She had made this decision before she came through the door, and she executed it without reconsidering. Faraway was fast. He was 51 and former field operations, and he was fast in the way that people who had trained for a very long time were fast. Not athletic fast, efficient fast, the kind of speed that didn't waste motion. He moved to intercept, and he was closer to Dana than she was, and he knew it. What he hadn't calculated was the chair. Dana moved. Her wrists were zip-tied to the chair arms, so she moved the chair, shoved it sideways with her legs, hard, deliberately, putting it between Faraway and herself in the half-second she had to act. The chair caught him at the knee, not enough to drop him, but enough to break his angle by 2 feet, and 2 feet was what Nora needed. She reached Dana first. She put herself between Dana and Faraway and faced him, and the next 40 seconds were the most dangerous 40 seconds of the night, because Faraway was not hampered by the same constraints she was. He was not trying not to hurt anyone. He was trying to win. And he was very, very capable. She was more capable. Not because she was better trained, though she was. Not because she was younger, though she was. Because she had spent the last 4 hours being compressed down to something essential, something that had burned away everything that wasn't load-bearing, and what was left was very simple and very clear, and very much not interested in what Douglas Faraway thought he knew about her. It ended when Braxton's team came through the northwest stairwell door. She had known they were coming. She had timed it. She had known the 45-second suppression window and the 3 minutes Braxton had asked for, and the interval between her entry and the point where he'd be in position. She had known they were 60 seconds out when she came through the northeast door. She had needed those 60 seconds to get to Dana. She had gotten to Dana. Faraway went to the floor with 3 of Braxton's people on him, and he was still functional enough to say, clearly and without panic, "I want legal representation. I want it documented that I am cooperating and that I have information of significant national security value." "You have the right to remain silent," one of Braxton's people said, "and I'd strongly recommend you use it." Nora was already crouched next to Dana, working at the zip ties with the folding knife Braxton had pressed into her hand at some point during the evening. Her hands were not entirely steady. She was aware of this, and she didn't try to fix it. She just worked around it, the way you worked around any imperfect tool when there wasn't a better one available. The first tie came free. Dana pulled her wrist to her chest and held it there. She looked at Nora from a distance of about 8 inches with an expression that had everything in it. The fear and the relief and the confusion and something older than any of those, the specific look of a sister who was seeing her sibling for the first time and understanding that she had not, until this moment, been seeing her at all. "Nora," she said. "I know," Nora said. She worked the second tie. "I know. We'll talk." "Are you?" Dana's voice broke and recovered. "What is happening?" "It's over," Nora said. "That's what's happening." The second tie came free. Dana grabbed Nora's arm with both hands, the wrapped right hand, the one that was stiff and sore, and held on, and Nora let her, and sat on the floor of a repurposed financial services office at 5:00 in the morning, and let her sister hold on for as long as she needed to. It was not clean. It was not a composed reunion. Dana cried and then was furious, and then cried again, the way people did when the adrenaline had nowhere left to go. Nora sat with all of it. She didn't try to manage it. She didn't try to explain anything yet. She just sat on the floor with her sister's hands on her arm and let the night finish arriving. Douglas Faraway was taken into federal custody at 5:17 a.m. He walked out of the building on his own feet, which he had insisted on, which was the last act of a man who understood that how you looked in your final public moment was the only variable you still controlled. His hands were cuffed in front. His face was composed. He looked, to anyone who saw him, like a man who had made a calculation and was executing it. Nora watched him from the building entrance. She watched him walk to the vehicle, watched the door close, watched the vehicle move. She felt nothing cinematic about it. She felt tired and her hand hurt, and the cold was finally winning the argument with her body temperature. The feeling she'd expected, the clean, completed feeling of a concluded thing, didn't arrive on schedule. What arrived instead was something more gradual and more honest. The slow recognition that the situation had ended and that the ending was real and that she was still standing. That was enough. Braxton found her at the entrance. He handed her a jacket, someone's spare from the vehicle, too large, warm. She put it on without being asked twice. "Federal marshals are taking over from here," he said. "The committee session has been moved to 48 hours from now. My team is delivering the drive and your testimony tonight. We'll do a recorded deposition, full documentation. Everything goes in with the Meridian package." He paused. "It'll be enough." "Will it hold?" "The procurement fraud alone is 18 counts. The asset exposure adds another 12. The payments to foreign cutouts." He stopped. "Yes, it'll hold." She nodded. "There's something," he said. He had the tone of someone delivering information he wasn't certain how she'd receive. "The federal investigation that's opening today, and it's going to cover the entire Kestrel program, the methodology, the oversight failures, the period when you were in civilian cover." He met her eyes. "They're going to need your account of everything that happened 3 years ago. Why you were pulled, what you flagged, what you were told, and by whom. All of it." "I know. That process is going to take months." "I know that too." He looked at her. "And your separation from Hargrove General, the termination. Given the circumstances, given that you were a reinstated intelligence asset operating under a compromised civilian cover," he paused. "That's going to be reviewed. The firing was documented during a period where the hospital administration was being investigated for its connection to Stell and potentially to Faraway's logistics network." She looked at him. "You're saying Deering's termination decision may have been compromised." "I'm saying it's going to be reviewed by people above Deering's pay grade." She thought about that for a moment. She thought about the badge on Deering's desk and the coat still in the locker and the 11 weeks of charting and patient feedback scores, and a 16-year-old with a sprained wrist whose mother had wanted x-rays of both arms. "Okay," she said. "Okay?" "Yes." She looked at the building, at the street beginning to show the first gray suggestion of early morning at the edges of the sky. "Okay." Marcus Hale was transferred to a secure medical facility at 7:00 a.m., with a proper surgical team and a proper imaging suite, and all the things that Hargrove General's Bay 4 had not been able to provide. He was moved on a gurney, awake, with an oxygen line and an IV, and the specific alert quality of a man who had decided that being transported was something he could manage if he managed it carefully. Nora walked beside the gurney to the transfer vehicle. "You'll testify," he said. It wasn't a question. "Yes." "The deposition will take— I know how long it'll take." He looked at the sky. The gray at the edges had moved towards something lighter. Not sunrise yet, but the approach of it. "You could have given him the names," he said. "Faraway." He would have let Dana go. "You could have ended it cleaner." "Those names are people," she said. "They're still active. He would have sold them the same way he sold the others." "I know. I'm not saying you should have. I'm saying you didn't." He looked at her. "That matters." She walked with the gurney to the vehicle and stood while the transfer team loaded it with the practiced efficiency of people who did this regularly. She watched Hale disappear into the back of the transport, watched the doors close, watched it pull away. She stood on the street. Dana came up beside her. Someone had given her a blanket. She was wrapped in it, holding it closed at the front, looking slightly unreal in the early morning light, the way people looked after nights that had compressed too much into too few hours. "You have to explain things to me," Dana said. "I know. Not right now, but soon." "Soon," Nora agreed. Dana looked at her, the older sister assessment, the one that had been unchanged since they were children, and that Nora had always found both irritating and necessary. "You're bleeding through that dressing on your hand." "I know." "Are you going to fix it?" "Yes." "When?" "Soon," Nora said again. The same word, a different weight. Dana made the sound that meant she was going to let something go for now, but had not forgotten it. She leaned slightly, not quite a lean, just enough contact to register. Nora felt it. She didn't move away. They stood on the street in the early morning cold and watched the city start its slow return to itself. The federal investigation opened formally at 9:12 a.m. that morning. By noon, the documentation package, the drive, the Meridian data, Nora's recorded deposition, covering the full operational timeline of the Kestrel program, had been delivered to the Joint Oversight Committee ahead of the rescheduled session. The committee's response was immediate and, for a governmental body, unusually fast. 3 members issued public statements before the end of the day. Douglas Faraway was charged with 18 counts of procurement fraud, 12 counts of unauthorized intelligence asset exposure, and 2 counts of conspiracy in connection with the deaths of assets whose identities he had sold. The charges were filed federally, publicly, without the kind of quiet administrative handling that people in his position sometimes received. His name was in the public record by evening. His photograph was distributed through the standard federal channels. There was no arrangement. There was no negotiated settlement. There was the full weight of what he had done, documented and presented and attached to his name without mitigation. That was the part that mattered. Not just that he was charged, that it was documented, that the record existed and was complete and could not be quietly managed into something smaller than what it was. Nora had understood during the deposition that this was the real work, not the confrontation in the dark office building, not the physical outcome of the night's events, but the hours she spent afterward in a room with a federal recorder and 3 investigators, giving the complete and accurate account of everything she had witnessed and everything she had carried in her memory for 3 years. That was the thing that would hold, not force, not confrontation, the record. Paul Deering's termination decision was reviewed by the hospital's board of directors and the federal oversight team simultaneously. The review took 6 days. At the end of it, the determination was clear. Deering had acted under pressure from a hospital administration that was under investigation for procurement connections to Stell's logistics network. His decision to fire Nora Voss had been made in an environment compromised by that connection. The termination was ruled improper. Nora received the formal notification on a Wednesday afternoon in the small apartment that was, for the moment, still hers. She read the letter twice. She set it on the kitchen table and made coffee and stood at the window and looked at the mountains, which were visible in the winter light with unusual clarity, the kind of clarity the air had after a storm had moved through and taken the haze with it. The letter offered her reinstatement. She thought about Bay 4. She thought about the 16-year-old with the sprained wrist and the mother who wanted too many x-rays. She thought about the patient chart she had kept with more precision than was required, and the small corrections she had made to IV lines and the way she had stood at the edge of a restricted bay at 1:47 a.m. and seen something that nobody else had looked at closely enough to see. She thought about what nursing had been for her in those 11 weeks, and in the months before, and in the years when she had been becoming something she'd chosen rather than something she'd been assigned. She picked up the phone and called Braxton. "The reinstatement letter came," she said. "I heard." A pause. "What are you thinking?" She looked at the mountains. "I'm thinking about what I'm useful for." "Those aren't the same question." "No," she said. "They're not." She paused. "The Kestrel program is being restructured. The Oversight Committee recommended a full review of the medical specialist positions." "Yes." "They're building something new out of what's left, with better oversight, smaller, more accountable." She paused. "They need a medical specialist who understands field operations and civilian trauma care." "I know," Braxton said. "I submitted your name last week." She was quiet for a moment. "You submitted it before the reinstatement letter came," she said. "Yes." "Before you knew what I'd decide." "I submitted it," he said, "because I know what you're good at. What you decide to do with it is your choice." A pause. "But I'd like you to make the choice with full information." She stood at the window for a moment longer. She thought about the careful life she had built in this apartment, the nursing license on the wall, the version of herself she had constructed around the premise that smaller was safer. She thought about how it had felt to stand in Bay 4 at 1:47 a.m. and step forward instead of back, not because she had forgotten who she was trying to be, but because there was a person dying and she was the only person in the room who could help him. That had not been a deviation from who she was. That had been exactly who she was. "I'm going to keep my nursing license active," she said finally. "Whatever I do next, I'm keeping it." "That's reasonable." "And I'm going to need time with Dana. Real time, not a phone call." "Also reasonable." "And my hand needs another week before I'm doing anything that requires full grip strength." "Nora." "Yes." "I know," he said simply. She almost smiled. "I'll call you Thursday." She ended the call and stood at the window and let the morning be what it was. Imperfect, cold, carrying the residue of a week that had cost her things she was still in the process of accounting for. The city below was doing what cities did, moving, adjusting, continuing without any awareness of what had happened inside one of its hospitals 4 nights ago. That was fine. Cities didn't need to know. She went back to Hargrove General once. Not to reclaim her position, she'd put that answer in writing 2 days later, a respectful and final decline. But because she had left her coat in the locker on the night she was fired, and she wanted the coat, and she had learned not to leave things behind that she still needed. She went on a Thursday morning during the day shift, when the floor was busy and the overnight quiet had given way to the organized noise of a hospital in full operation. She badged in on a temporary visitor pass, which was its own small commentary on how things had changed and not changed. Dale was at the nursing station. He saw her come off the elevator and held her gaze for a moment, the long, specific look of someone deciding what they wanted to say. And then he nodded, just a nod. But it was the kind of nod that contained a full sentence. She nodded back. The younger nurse, the one who had watched her walk the corridor after the firing with open dismay, was coming out of a patient room with a chart. She stopped when she saw Nora. She looked like she was deciding between several responses. "You were right," she said finally. "About the bruising, about the airway. Everyone's been talking about it." "Good," Nora said. "Learn it. The pattern is specific, but it's learnable." The younger nurse looked at her for a moment. "Will you come back?" Nora thought about the letter she'd already sent, the decision she'd already made, the phone call she was going to make to Braxton on Thursday, which was today. "No," she said, "but the person who comes after me will. Make sure they have room to do it right." She got her coat from the locker. She stood in the break room for a moment. The familiar smell of it, the terrible coffee machine, the whiteboard with shift notes in 3 different colors of marker. The small, ordinary machinery of a place where people spent their nights keeping other people alive. She had been grateful for it. She was still grateful for it. Gratitude and departure were not opposites. She put the coat on. She walked out through the ambulance bay, the same door she'd walked through at 2 a.m. on a night that had not turned out to be the night she expected, and into the morning air, which was cold and clear and smelled like February giving way to something slightly less brutal. She stood outside for a moment. Here was the thing about being underestimated. The thing she had turned over in her mind during the deposition and during the 6 days of waiting and during the long, necessary conversations with Dana that had started halting and become something else entirely. Being underestimated didn't break you. It revealed you. Every person who had looked at her and seen a probationary nurse, a quiet woman, a liability, a loose end, every one of those assessments had told her something true about the people making them and nothing true about her. She had not been made smaller by being seen as small. She had simply been waiting in a shape that didn't require them to see her accurately. The night they fired her for saving the wrong person was the night they found out they'd been wrong about which person she was all along. She had not needed them to be right about her. She had only needed to be right about herself. That was the part that held. Not the vindication, though the vindication was real and documented and attached to names in a federal record. Not the recognition. Though the recognition came in formal letters and a federal deposition and a position she would accept on Thursday with full understanding of what it required. What held was the simpler, harder thing that she had known in that bay at 1:47 a.m., that stepping forward was the right thing, and she had done it without knowing what it would cost. And the cost had been significant and real, and she had paid it, and she was still standing. That was what the careful version of herself had forgotten. That standing still was also a choice. That staying inside the lines was not safety. It was just a different kind of risk, slower and quieter, and easier to ignore until the night came when ignoring it was no longer possible. She had not been looking for a way back to who she used to be. She had been becoming someone who contained both. Nora Voss zipped her coat against the February air and walked toward the parking lot and the car and the phone call she was going to make. And the city extended around her in all directions with its ordinary, enormous, indifferent life, and she moved through it as exactly and entirely herself. Not the version she'd been assigned, not the version she'd been trying to maintain, but the version that had walked into a restricted bay in the middle of the night because a man was dying and she was the only person in the room who understood why. That version didn't need anyone's permission.